If you said A, the mitral valve, you are correct. This patient has Marfan syndrome, a genetic connective tissue disease that classically causes mitral regurgitation and aortic root dilatation or dissection. Mitral regurgitation can also be caused by progression of mitral valve prolapse, infections like endocarditis, and functional regurgitation due to stretching of the valve and dilated cardiomyopathy. Acute mitral regurgitation can be caused by acute chordae tendineae rupture and classically presents with acute onset heart failure symptoms. Chronic mitral regurgitation also causes heart failure symptoms that progressively worsen over time and can increase the risk for atrial fibrillation due to atrial stretching. On exam, you will hear a hollow systolic murmur that is loudest at the apex and radius to the axilla. EKG will commonly show left atrial enlargement. Management depends on the cause and the severity of disease. Medical interventions are intended to delay progression by reducing preload and afterload to decrease the amount of blood inside the heart. This is accomplished with ACE inhibitors, ARBs, beta blockers, and calcium channel blockers. Surgery may be indicated depending on the degree of regurgitation and the patient's symptoms. The goal is to intervene with either mitral valve repair or replacement before the ejection fraction decreases due to dilated cardiomyopathy. Mitral valve prolapse is when the leaflets of the mitral valve flop back slightly into the left atrium during the ventricular contraction. In mitral valve prolapse, the tissues of the valve can be abnormally stretchy, causing this valve to leak slightly. In most cases, this is asymptomatic and does not progress to mitral valve regurgitation and does not require treatment. In the event patients are symptomatic, symptoms can include palpitations and atypical chest pain. On exam, you will hear a mid-systolic click followed by a mid-systolic murmur. This murmur will increase in length and intensity with maneuvers that decrease the left ventricular volume, like standing suddenly, Valsalva, and the hand grip maneuver. Mitral valve prolapse only requires treatment in the uncommon scenario when it progresses to mitral valve regurgitation. Click through to hear the murmurs of mitral regurgitation and mitral valve prolapse, and then we're on to the next question.